Welcome back to Face the State. I'm Ariana Bennett. Thank you for staying with us. Before the fourth year, the health insurance enrollment under the Affordable Care Act is open for new signups. But this year, the process is under kind of a shadow of rising premiums and the possibility that the whole program could be scrapped under a new administration. So Janelle Davis from the Silver State Health Insurance Exchange is here to talk about that. Janelle, thank you for coming on the show.
Thank you for having me.
All right, so open enrollment is going on now. How's it gone so
Correct.
far?
So far, so good. Not too many changes. Open enrollment began Tuesday, November 1st, 2016. So we've had a couple weeks to, work out the kinks and see how it's going. It goes all the way through January 31st of 2017. So folks have about 3 months to sign up for a health insurance plan.
And I understand this time we've gotten kind of a big flood of people signing up, probably due to some uncertainty in the political climate. Is that what we've seen in Nevada as well?
Yes and no. I think nationally we've seen about an increase of 250,000 new enrollees. So that's, throughout the 39 states in the marketplace. For Nevada, I think the trend is going up. It's similar, and I think folks are scared that they don't know what to do. They don't know if they should enroll in a plan. They don't know if they should stay with what they currently have. And the answer is yes, they should. The Affordable Care Act is still a law, and it's still a mandate. The penalties still exist, and I think that's really important for folks to understand that if you don't have health insurance coverage through the marketplace or through your employer, you will get fined still, even with a possible new administration and a dismantle of the repeal and replace of the Affordable Care Act.
Right. So hypothetically, if the ACA gets repealed as soon as possible, that still probably wouldn't be for several months down the road at the very, very earliest, and then wouldn't probably be taking effect until, possibly following year, even 2 years. So we're still looking at the same system being in place for a little while,
Correct.
Which means when you file your taxes the following time,
Yes.
you may see a penalty on there if you're not in compliance.
Correct. So you'll see a penalty. The penalty has not changed. So per individual, it's $695 per individual, or 2.5% of your annual income, whichever is higher. And that could go up depending on how many people are in your household. So, and you're right about the transitional period. The president-elect and vice president-elect want to protect consumers, but even though they may not veto the bill this go-around because they want to repeal it, it's still going to take about a 2-year transitional period. So if Nevadans are scared, and rightfully so, it's still going to take a lot of time. If you remember, Obamacare took 4 years to implement, so imagining the dismantling of the product could take even longer.
Is there a possibility, and I know there's a concern for this, but within your knowledge, is there a possibility that people who sign up for a health insurance plan through the marketplace, if it gets repealed, could they lose that plan?
So I do know that Vice President-elect and President-elect want to protect consumers, and they want to protect those federal subsidies. So it's really unclear what could happen right now, but I know that they want to ensure that there's no issues with those collection of federal subsidies, and what we like about the Affordable Care Act is those pre-existing conditions, and people can stay on their parents' plan until they're 26. So they want to keep those provisions of the law, and I think the main issue is consumer protection. People want to keep those plans, and I think the president-elect wants to protect those consumers as well.
Okay, so for now the advice is still sign up. You've got some time to do it. So what do people need to know who are thinking of enrolling this time around?
Sure. So open enrollment goes through January 31st, 2017, so we have a little bit of time here still. To start the process, I would recommend that Nevadans, you need to be a Nevada resident and not be covered through a health insurance plan through your employer currently. But even if you're underinsured, we recommend these individuals look into Nevada HealthLink. So I would recommend to go to nevadahealthlink.com, take a pre-screener, which is a series of questions based all on your income, to see if you're eligible for a qualified health care plan or eligible for Medicaid. So it's pretty simple, pretty easy process. We also encourage Nevadans to go online to our in-person assistance tool, and here they can find free local help with an enrollment professional, a licensed enrollment professional, so with brokers or agents or navigators to help guide them through the process since premiums have changed and plans have changed.
Right, and speaking of premiums, looking at increases to the premiums nationwide of, I think, an average of about 25% across
Yes.
the country. How is that going to affect Nevadans specifically?
So you're right, the national increase on average was about 25%. So that's a pretty big double-digit number. For Nevada, we're at about 10.43%. So we're well under the national average, so it's not as scary. But I think what's important to note is that when premiums go up, so do those subsidies. And 80% of Nevadans are eligible for subsidies. So those folks shopping the marketplace need to understand that they could be eligible for that federal assistance. So even though premiums are going up, hopefully that federal subsidy assistance will help offset that monthly premium.
How do the subsidies work? Is it something that people pay out of pocket and then they get reimbursed, or?
Yeah, they'll get reimbursed when tax season comes around, correct?
Okay, so it'll come through their tax return?
Yes, exactly.
And you said about 80% of people. Are those people within the marketplace or 80% of Nevadans total?
Well, there's about 350,000 Nevadans still uninsured. So that's a roughly 12% number of Nevadans who are still uninsured. So those folks still shopping the marketplace who are uninsured are eligible for the federal subsidy.
What's a feasible number for getting that 12% in? I mean, I know 100% is probably a little overly ambitious, but what are you guys going for?
So if you go back to 2014 when open enrollment first started for the state of Nevada, we were at about 35,000 enrollees. And then we had the Xerox debacle, and then we kind of came back and we were up to about 65,000. Well, this last year, we were at 88,145 individuals. So we're hoping to keep that trend. So far, it's looking good. I think there'll be a really big push after Thanksgiving. But, you know, yeah, we hope to reach that mark, if not more.
Okay, so for those who are still uninsured, they're paying the penalty, right?
They're paying the penalty.
The penalty's gone up, obviously, since the beginning. So are we at the point yet where the penalty costs more than the premiums you'd be paying for insurance anyway?
I think it's getting to that point. I think Nevadans and all people shopping the marketplace are kind of realizing that. I think you really need to put it into perspective and your budget and see how can I make this affordable? How can I put this into my budget? You know, there's a lot of healthy people out there who say they don't need it, and that's understandable, but it's also important to budget for this because you could go into debt if you go into hospital bills. So I think it's just really doing the research, educating yourself, talking to a licensed enrollment professional who knows these insurance plans in and out to see if this is really budget appropriate for you and your health needs.
Okay, now if you want to speak to someone in person, I know that there's help out there that's
Yes.
free, right?
It is free local help. So we have, like I said, our in-person assistance tool, which is on our website, nevadahealthlink.com. Folks can go online and put in their address or their zip code. They can find a licensed enrollment professional, so a broker or a navigator, certified application counselors, enrollment assisters. All these people have been certified. You can also go online to the Division of Insurance website, and they have a Rate Wizard tool, so you can kind of look at the plan by plan and see how much it might cost an individual. But I'd also like to mention that we will have, we're out there in the community, so we're at outreach events, and we're building our stakeholder relationships, and we're out there. So you should see us, and we will be doing enrollments during the open enrollment time. But there's a deadline date coming up, and that's December 15th. And we encourage people to really get out there and enroll that day, because if you get enrolled on December 15th, you'll have coverage by the first of the year. And so we will actually be hosting an event at the Pepper Mill in Reno from 12 to 7 p.m. that day, where folks can just go get that free in-person assistance and enroll right then and there on the spot. And we'll also have an event in Las Vegas as well.
Okay. I know health insurance for a lot of people is a financial hardship. It's, you know, it is expensive. It's an unfortunate system that healthcare is so expensive in this country. And now that they're legally required to get it, I think it grates on some people that they are having to stretch their budget even farther. With premiums going up even more, even though we're not going to see as high premiums in Nevada.
Right.
What's the message to those people who say, this is just not feasible for me?
Yeah, you know, there are a lot of individuals. we have plans that are eligible for a wide range of individuals. I mean, I'm talking 18 years old to the 50 plus. And it really just depends on the individual and what they make, since these are all income based. It's a really fine line between a QHP, a qualified health care plan, or Medicaid. And I think Medicaid expansion in our state's also really important, because we're seeing a rise in young people, especially the millennial generation. And they're a tricky one too, because they say, well, I'm healthy, I'll just pay the fee. But again, I think the message we go back to is, well, you need to put that into your budget and see what's available, and then also that federal subsidy help. There's so many people who don't realize that they may be eligible for that. So
Right, good to remember that the fee you pay and get nothing for it.
yeah.
But the premiums you pay and actually get health insurance for it, so might be worth it in the long run.
Yeah, exactly.
Okay, we got about a minute left. What's the final message to people? What do they need to know?
So open enrollment goes through January 31st, 2017. The Affordable Care Act is still a law. We still encourage all Nevadans to shop the marketplace. Premiums have changed, plans have changed. Go out there and get that in-person assistance. Give us a call, write us an email, call your broker, and make sure your plan is exactly where you need it.
Okay, and number of providers hasn't changed, right?
Number of providers is still the same as last year, so Health Plan of Nevada, Prominence, and Anthem PPO and HMO.
Okay, Janelle, thank you so much for your time.
Thank you.
I sure appreciate it.
I appreciate it.
Well, that is it for this episode of Face the State. But for more information on all of this, or to see past episodes, you can just head to our website. That's ktvn.com. Thank you so much for being with us. We'll see you next week.